So first we're going to provide some local anesthesia to the patient, and this is just going to be numbing up the area out on the skin outside the bone. This is using a very small 27 gauge needle and just some 1% lidocaine. So here we're anesthetizing the skin over the fibular head. And then because we're going to be doing prolotherapy and actually doing some bony irritation, we're going to take that same anesthetic agent and go right down on top of the bone and numb that area up so that we're not going to give her too much discomfort during the procedure. And then we're going to do the second thing here proximally over the lateral femoral condyle at the origin of the lateral collateral ligament. Again, here we're just anesthetizing the skin. Now we're going to go a little bit deeper and make sure we're anesthetizing that bony site really well so that when we do the prolotherapy itself, she's not going to have much discomfort. Now we're going to start the prolotherapy itself. So this syringe has 1 cc of testosterone, about 1/4 cc of HGH, which is human growth hormone, 4 cc's of 1% lidocaine, and 4 cc's of 50% dextrose. So at each site, using sterile technique, we're just going to go right down to the bone. She should be pretty well anesthetized at this point. Do you feel that at all?
No.
Okay. And we're just going to do a little bit of stimulation at that bony site, usually about 10 pokes at each location. Inject a little bit more injectate. Reposition the needle slightly, making sure we have contact with the bone at every time for an additional 10 pokes. A little bit more injectate going in. Repositioning one more time. Again, that bony contact is critical for safety. And just very gentle pokes down onto the bone. We've used about 50% of our injectate there. We're going to kind of shake that up a little bit, make sure the testosterone is well mixed in. And we're going to repeat the same procedure with the lateral femoral condyle. We're just going to reposition slightly. Again, making sure we're right on bone. Almost done. We're doing great. Reposition that needle one more time without changing our entry point through the skin. Little bit of injectate in. Sometimes that last bit can be hard with the small gauge 22 gauge needle, and we're done.